Assalamualaikum, I am NURUL AMIRAH binti ASNORUSDI, and today I will brief about the policy that we have been choose, which is mental health policy. And the example of the policy is National Strategic Plan for Mental Health 2020 until 2025. Before that, let me explain the definition of mental health policy. According to World Health Organization (WHO) 2004, mental health policy is a set of policy that aim to improve mental health, reducing mental health issues, addressing the stigma, along with provide mental health care for people. Next, National Mental Health Policy. National Mental Health Policy has been established by Ministry of Health, Malaysia, in 1998 that aim to foster psychological balance and prevention of psychological issues. A research from WHO 2024 has stated that Malaysia has enhanced the effort to strengthen mental health among children and adolescents by creating National Strategic Plan 2020 until 2025. So by the time 2025, they aim to reducing rate of depression among adolescents from 18% to 10%. Furthermore, National Strategic Plan Mental Health 2025 is aspired to be guide for all stakeholders that involved in provision and mental health service. Next, National Health and Mobility Survey. National Health and Mobility Survey was first initiated in 1986 and conducted once every 10 years. It is an important platform for monitoring health of population in Malaysia. The aim of NHMS to provide community-based data on mental health problem, health service utilization, and health expenditure in the community. And last, Mental Health Act. Mental Health Act was enacted in 2001. Is a legal provision of rights for people that has been admitted and treated inpatient to receive mental health.
Hello everyone, today I'll be sharing key mental health policy problems in Malaysia based on the National Strategic Plan for Mental Health 2020-2025 by the Ministry of Health. Mental health is now a critical public health concern affecting people of all ages, and urgent reforms are needed to address these growing challenges. The first policy problems that we are facing is increasing mental health burden. One of the biggest concerns is the rising mental health burden in Malaysia. According to NHMS 2015, 29.2% of Malaysians aged 16 and above were experiencing mental health issues. By 2019, 2.3% of adults had been clinically diagnosed with depression. Mental illness also contributes to 37% of the total disability burden in the country, according to the Ministry of Health 2020. These numbers shows how widespread and serious the problem has become. So the next policy problem is youth mental health crisis. According to NHMS 2017, revealed that 18.3% of teens aged 13 to 17 showed signs of depression, 10% had suicidal thoughts, and 6.9% had attempted suicide, according to Munyandi 2024. The pressure to perform academically, peer influence, and constant exposure to social media have all played a role in this youth mental health crisis. Next is stigma and low mental health literacy. Despite awareness efforts, mental illness is still seen as taboo in our society. Stigma leads to social isolation and even cyberbullying, especially among teens. A study showed that only 16.4% of adolescents have adequate mental health literacy, and those with low literacy are 1.52 times more likely to suffer moderate to severe depression, Pavitra 2024. These gaps prevent people from recognizing symptoms or seeking help early. Another problem is the shortage of professionals and unequal access. Malaysia currently has only 385 psychiatrists, far below the WHO recommended ratio 1 per 50,000 people. The Ministry of Health also employs just 30 clinical psychologists and 1.8 counsellors. Most of them are concentrated in urban areas, leaving rural communities with limited access for mental health services. This creates a serious treatment gap, especially for those in remote regions. Another issue or problems is inadequate budget and funding. Only 1.3% of the national health budget is allocated for mental health, which is lower than the global average for upper middle income countries, according to the Ministry of Health Malaysia. This limits the development of services, outreach programs, and training. It also makes therapy and medication less affordable, especially for long-term care. Next is outdated laws and criminalization. The legal framework is also outdated. The Mental Health Act 2001 hasn't been updated in years, and suicide attempts and drugs use are still criminalized. This discourages people from seeking help when in crisis and reinforces harmful stigma. Hamza and Othman 2024. Decriminalization and legal reform are needed to align with modern human rights standards. Next problem is weak data and surveillance. Malaysia lacks a centralized and standardized mental health data system. Data is scattered and often outdated, making it hard to track trends or evaluate programs effectively. According to Mukris 2023, this limits the government's ability to allocate resources or respond quickly to emerging issues, and also there's also no national suicide registry. Another problem that we are facing is lack of disaster preparedness. Another gap is the lack of mental health planning in disaster responses. Events like COVID-19, floods, or other crises have shown that psychological support is often missing. There are no trained psychological first aid teams, and response plans rarely include mental health services. This leads to long-term emotional trauma for victims. The last problem that we are facing at the moment is emerging digital threats. The new digital threats are affecting mental health. Issues like cyberbullying, online gaming addiction, and social media overuse are harming especially young people. These contribute to anxiety, depression, and poor self-esteem. While national data is still limited, the strategic plan recognizes this as growing challenges that need immediate attention, according to the Ministry of Health 2020. In conclusion, Malaysia faces serious mental health policy problems, from rising illness rates and youth depression to stigma, limited access, outdated laws, and digital risks. The National Strategic Plan for Mental Health provides a solid starting point, but ongoing support, funding, and collaboration across sectors are essential to truly improve the national mental well-being.
Next is policy objective and strategies. There are 4 targeted objectives as stated in the policy, along with the strategies and activities. So first objective is to reinforce mental health promotion and prevention strategies and improve mental health literacy. So one of the strategy is promoting mental health and well-being. Example of program done by the government is Malaysia Mental Health Film Festival. It's an annual event which takes place on October 10th every year, where it showcases an impactful stories to destigmatize mental health. Next example of activity is PROSIS, stands for Program Siswa Sehat, or known as a Healthy Student Program. It's a collaboration between Ministry of Health Malaysia, Ministry of Higher Education, and Ministry of Education Malaysia to empower students in practicing a healthy lifestyle. It has already initiated in several selected public universities, but now has expanded to community colleges, matriculation, polytechnics, and also teacher education institute. So next strategy under this objective is establishing and nurturing intra and intersectoral collaboration. For example, government provide marriage and retirement counselling. As for marriage counselling, government under family institution provide a pre-marriage courses for those future couples, and how to manage divorce and rujuk for those who want to seek for it. And as for retirement, government will assist you on how to prepare yourself for retirement. Second objective is to further strengthen, streamline, and coordinate activities related to mental health. First strategy is enhancing governance and regulatory framework. For example, decriminalizations of suicide attempt. For your information, Malaysia Parliament has passed 3 bills in the Penal Code in 2023 related to decriminalize suicide. This is because Malaysia psychologists who studies about mental health and suicide risk stated that when government criminalize suicide, people who attempt suicide are discouraged from coming forward, as if they survive suicide, they will actually be thrown into jail potentially. So by decriminalizing suicide, it's the first step toward building a more comprehensive framework for suicide prevention and rehabilitation. Second strategy is strengthening mental health surveillance system. For example, government developed Mentari IT system. So when we talk about Mentari, Menta stands for mental and Re stands for psychiatry. So it was initiated as a response to requirements of a new Mental Health Act and regulations. It's a community-based services to improve mental health of the population, and it is managed by the Departments of Psychiatry and Mental Health. Third objective is to provide comprehensive, integrated, and responsive mental health services at all levels by addressing the gaps. First strategy under this objective is ensuring the availability and accessibility of comprehensive and quality mental health services. For example, e-mental screening tools, such as BHQ, Patient Health Questionnaire, and then we have DASS, DASS, Depression, Anxiety, and Stress Skills. So these, the result from those tests can be used as a guide in identifying early symptoms and indicators for treatment. So next strategy is strengthening mental health resources. How? Through a caregiver training manual. So who is a caregiver? So caregiver basically is someone to assist the disabled, elderly, and chronically ill persons, and it is essential for them to have a basic knowledge in caregiving. Why is that so? Because caregiving sometimes can be emotionally, which lead to stress, anxiety, and depression, and that is why such caregiver training is important to reduce burnout and improve the quality of care they provide. Next strategy is strengthening mental health resources by creating surveillance system. Because in Malaysia, mental health surveillance is primarily observed through National Health and Morbidity Survey, and also Ministry of Health also use data from National Mental Health Registry and National Suicide Registry. And the main purpose of these observations is to monitor mental health trends among the population. Last objective is to ensure that the right of the mentally ill must be valued, protected, and promoted. One of the strategy is enhancing governance regulatory framework by reviewing outdated laws and policies, including mental health acts and regulations. Next is addressing suicide and suicidal behavior through a post-vention pathway for suicide survivors. So post-vention is basically a suicide prevention field where the primary function is to facilitate the healing of individuals from the grief or distress of suicide loss.
Next, moving on to the policy evaluation. In this part, I will explain about the strength of policy objective that we have been achieved as we apply it. First objective, to reinforce promotion of mental health and prevention strategies to improve mental health literacy. According to NAS et al. 2024, as cited by Pavitra 2034, mental health literacy program can raise awareness, reduce stigma, and promote positive attitude toward mental health that are really effective in help-seeking behavior. In this survey, it stated that 16.4% of adolescents have an adequate mental health literacy, while the rest still lack an adequate mental health literacy. An example of recent studies from another country by Zindi and June 2023 demonstrate that integrating group intervention and personal counseling within psychological interest group provides structured, consistent, and ongoing psychological support to medical students. The study found that post-intervention, anxiety, depression, and somatization symptoms decreased significantly to 7.44%, 18.18%, and 9.92% respectively. For the third objective, to provide a responsive mental health service at all levels by addressing the gaps. According to Ministry of Health 2020, the National Strategic Plan for Mental Health 2020 until 2025 aim to improve the access of mental health service in primary, secondary, tertiary based on school setting by creating e-mental health screening apps for early intervention. Moreover, UNICEF Malaysia Kita Kenyak program has raised mental health awareness among 270,000 young people through online session and virtual. Another finding is the Mental Illness Awareness and Support Association (MIASA) has launched a crisis hotline that available 24/7 for psychological help on mental health. The vision to raise awareness and strengthen individual human rights, particularly among the disabled community. The data from August 2020 to July 2021, MIASA has received 48,626 cases, which are 9,012 calls, 18,093 message, 8,514 social media posts, 707 emails, and 12,300 face-to-face and virtual sessions. It can be concluded that mental health service offer crisis hotline to assist individuals in overcoming their mental health issues.
So now I am going to talk about the weaknesses of this policy. The first weaknesses of this policy came from policy problem number 3. So it may seem that the National Strategic Plan for Mental Health has no flaws whatsoever with all of their achievement. It is actually quite the opposite, because anything regarding mental health has been discriminated against throughout our whole history and only has been taken seriously in recent years. One of the weaknesses of this policy is high stigma and low mental health literacy. According to Ministry of Health in 2020, the stigma towards mental health problems and mental illnesses in our country still remains high, and people who are socially excluded because they suffer from mental health issues, which has led to insufficient support from the community. According to Raj et al. 2021, only 20% of Malaysians with mental disorder are expected to seek professional care. A group of traditionally conservative individuals in Malaysia tend to seek out religious practitioners or shamans instead of seeking medical care due to lack of knowledge and comprehension of mental illnesses. According to Fang and colleagues, 54% of psychiatric patients in Malaysia had at least one encounter with traditional healer prior to seeking psychiatric services. And according to earlier research, 62 until 69% of people with mental health issues initially sought out help from a conventional healer rather than a professional one. We can see that whenever someone opens up about their mental illness, they would not be taken seriously or would be labeled as crazy, especially in social media, which leads to cyberbullying. According to Khairin Amin in 2024, the continued increase in stigma indicates that existing approaches might not be adequately addressing deeply embedded cultural ideas, which accounts for the general public's and even family member lack of awareness. Okay, so the next weaknesses derives from policy problem number 4, which is shortage of professional and unequal access. The resources and workforce for this plan are limited to say the least. Severe shortage of mental health professionals such as clinic psychologists, counselors, and therapists in our healthcare industry could contribute to this shortage. At the same time, as rural communities are being actively neglected, mental health services are being reduced in urban areas. So according to Mukris et al. 2023, a set of data from 2018 indicates that states like Pahang, Kedah, and Sabah had psychiatrists to 100,000 population ratio of less than 1, while states like Kuala Lumpur and Selangor had ratios of 1.2 and 5.2 respectively. According to a set of data by Ng in 2018, calculation of the total number of psychiatrists and their ratio to the population of 100,000, there were 410 registered psychiatrists in Malaysia working in government hospitals, private clinics, public universities, and private universities. And in comparison, Malaysia has 623 registered psychiatrists as of 2024. 4 years after this plan was implemented, according to Sina Daily. This number includes 385 specialists in government hospitals, 102 in public and private hospitals, 26 in private universities, and 8 in hospitals run by the armed forces. This is, however, a long way from meeting current needs. In addition, the Health Ministry stated that in 2021 that it hoped to reach the national ratio of 1 psychiatrist for every 50,000 people by 2025, which would call for 720 psychiatrists in total. Bernama reported that this means that 97 more psychiatrists are needed before 2026 in order to reach this goal. So the next weaknesses came from policy problem number 5, which is inadequate budget and funding. The National Strategic Plan for Mental Health funding is considered insufficient, to put it lightly. Common mental illnesses like depression, anxiety, and personality disorders account for the majority of the mental health conditions that remains untreated due to financial limitation. In 2015, Harvard University and Malaysian Ministry of Health study estimates that by 2030, mental illnesses will cost Malaysia's economy more than $25.3 billion US dollars. While the total health budget represents 4.5% of GDP, mental health expenses make up for 1.3% of all government health spending. As stated by SUK 2020, RM344.82 million or 1% of the health budget was spent on mental health in 2018, which is still less than the average for upper middle income nations. Despite the Malaysian government efforts to address the rise in mental health conditions such as hiring more lay counsellors. So Mukris et al. Said that the provision of this specialized funding for mental health is essential for creating, executing and sustaining mental health services. About 0.89% of the healthcare budget in 2024 has been set aside specifically for mental health. This is a decrease from a budget 2023's prior, which is 1.11%. Somehow, the fund appears to be declining rather than increasing annually, which makes the difference between 2018 and 2024 budgets alarming. Last but not least, the weaknesses derives from policy problem number 7, which is weak mental health data and surveillance. Furthermore, this policy has insufficient data and monitoring system in terms of previous patient records. As mentioned by Mukris et al. 2023, existing data collecting on mental health issues tend to be scattered, insufficient, and not publicly available. Researchers, especially those studying in public health policy, lack of current grasp Malaysia's mental health situation because of the inconsistent and out-of-date data. As a result, without timely and accurate data, it becomes challenging to design effective interventions, allocate resources appropriately, or evaluate the success of ongoing mental health programs. Our country has to heavily rely on other developed countries such as the United States of America in terms of mental health care data because they have much more refined plans such as the Grand Challenge program, which seeks a proposal for research and demonstration projects to advance knowledge for effective prevention and early intervention for mental health behavior and disorders. Our nation must rely heavily on them for mental health care data, according to Weinberg et al. 2017. Last but not least, the weaknesses derives from policy problem number 7, which is weak mental health data and surveillance. Furthermore, this policy has insufficient data and monitoring system in terms of previous patient records. As mentioned by Mukris et al. 2023, existing data collecting on mental health issues tend to be scattered, insufficient, and not publicly available. Researchers, especially those studying in public health policy, lack of current grasp Malaysia's mental health situation because of the inconsistent and out-of-date data. As a result, without timely and accurate data, it becomes challenging to design effective interventions, allocate resources appropriately, or evaluate the success of ongoing mental health programs. Our country has to heavily rely on other developed countries such as the United States of America in terms of mental health care data because they have much more refined plans such as the Grand Challenge program, which seeks a proposal for research and demonstration projects to advance knowledge for effective prevention and early intervention for mental health behavior and disorders. Our nation must rely heavily on them for mental health care data, according to Weinberg et al. 2017.
My name is AISYAH. Just now you have listened to the weaknesses, and now I will present about the recommendation to address the weaknesses and improve mental health services in Malaysia. The slide shows 4 recommendations: increase mental health awareness and literacy, expand mental health workforce and services, strengthen mental health funding, and improve mental health data collection and monitoring. Let's start with increasing mental health awareness and literacy. In Malaysia, there's still a lot of stigma around mental health and many people don't really understand it. So it is important that we raise awareness through all kinds of platforms like TV, Instagram, Facebook and others.
campaign should reach everyone, including students, parents, workers and professionals, because mental health affects all of us. By spreading the message widely, especially on social media, more people can learn to recognize early signs and offer support. A study by Ketyal 2023 actually found that these platforms are effective because they reach a huge audience quickly. The goal here is to help people understand mental health better, support those in need earlier, and reduce the stigma or reduce the negative perception that still exists in our society. Next, expand mental health workforce and services. For your information, one of the biggest challenges or weaknesses is the lack of professionals, especially in rural areas. To fix this, we need to train and hire more people, and we need to make sure services are also available outside of big cities. The solution must come from the higher level, which is the government itself, and the government also needs the input from the communities. A good example comes from Alabama, where a hospital worked with rural communities to set up telepsychiatry services. They listened to what the people actually needed, and that made the project more successful. Why not Malaysia can take the same approach like Alabama do? If we involve rural communities in planning mental health program, the services will be more relevant, accepted and effective. Next is mental health funding. There is a study by Tom in 2022 where they found that funding from California's mental health tax actually helps slow down the rise in suicide rates. The thing is, with more stable funding, mental health services in those areas could keep up with demand. As a result, suicide rates went up more slowly compared to places without that funding. Looking at Malaysia, we have recently allocated 34 million ringgit for mental health in budget 2023. That is a positive step. But we need to make sure it is consistent and strategic, focusing on long-term improvement, especially for serious cases like suicide prevention. Another thing we could not forget is the geographical aspect. Right now, a lot of mental health services are concentrated in big cities like Kuala Lumpur and Selangor. But what about places like Pahang, Kedah or Sabah, where there is shortage of psychiatrists? We really need to make sure everyone, regardless of where they live, has access to the services. Next point is improve mental health data collection and monitoring for mental health. In a review of studies on mental health in Malaysia, 8 out of the study on healthcare workers mainly use survey. But the problem is the current system for collecting this data is still pretty fragmented. That means it's not very efficient. So what can we do? Well, Malaysia could benefit from developing a centralized and standardized mental health database, something that can collect, store and update patient record across all healthcare providers. A great example of this is Estonia. You can Google it. Estonia, they have built a fully integrated digital health system that stores all healthcare, that stores all patient information like medical history, prescription and test result, all in one place. And both doctor and patient can access it easily. They also use digital ID card and blockchain to keep the data secure. If we could do something similar in Malaysia for mental health, we could be able to improve the quality of care and make it much easier to track patients' progress, no matter clinic or hospital they visit.
In conclusion, the National Strategic Plan for Mental Health 2025 is a comprehensive effort to improve Malaysia's mental health system. It highlights the key challenges such as the rising mental health burden, youth depression, stigma, workforce shortages, and limited access to care. While the policy outlines strong strategies, its success depends on addressing ongoing issues like insufficient funding, outdated legislation, and weak data systems. Achieving its goals will require continuous collaboration, stronger implementation and sustainable investment. If these challenges are properly managed, the plan has the potential to create a more inclusive, responsive and resilient mental health system in Malaysia.
My name is Anishwada and I'm from Group 2, and the question is, according to policy objective, how does marriage and retirement counselling related to the mental health?
The question is basically asking about how marriage and retirement counselling related to mental health. So as for marriage, we need to acknowledge that whenever a couples enter into a marriage life, they will face a certain conflict. They will have problems, domestic violence and etc. So it will somehow lead to stress, anxiety and also depression. So this counselling is actually helping them to make better solutions, to come up with a better solution and also to prevent a family breakdown. And as for retirement counselling, how does it relate to mental health? You need to know that whenever someone is going to retire, they will face a loss of identity, especially men, because men is used to be a provider in a family. They used to provide a lot for the children, for the wife. So whenever they are retired, they will lose an identity of a provider and they will face a certain risk of depression. So this counselling that the government has provided is somehow important, essential for them to prepare themselves on how to face a retirement phase and how they can manage the emotions after the retirement.
Hi, my name is Nagrima. I'm from Group 3. I have a question to ask. How does this program support individuals in improving their mental health? Thank you.
Thank you, Koima, for the question. To answer the question, mental health program can support individual, staff, and students by creating a supportive environment for a healthy well-being. For example, education. Education can teach them about the mental health and also reduce the stigma. Second, access to support service. They can reach to the counselors for their mental health problem.
Okay, my name is AISYAH and I am from Group 4. So my question will be based on your recommendations. So the question is, if the funding is given but the stigma is still high, do you think that funding alone will solve the problem of the mental health?
To answer that question, no, funding alone is not enough. Without reducing stigma and increasing awareness, people might not even use the services provided. Both funding and education must go hand in hand for true improvement. For example, Japan has good healthcare funding, but because of stigma toward mental illness, suicide rate remained high for a long time. Only after running a large-scale awareness campaign, the suicide rate began to drop. This proved that funding must work together with education.
Assalamualaikum. My name is Muhammad Fakir. So for this topic, I have a question. So EMIR, why do you think mental health issue in Malaysia have increased in recent years? That's all. Thank you.
Thank you, Zul, for the question. So, answering to that, honestly, I think it's because life has just become a lot more stressful for people. We are all dealing with so much, whether it's pressure from school, work, or even just trying to meet expectations. And for our generation, especially, social media plays a big role. We're constantly comparing ourselves to others, and that can really affect how we see ourselves. I also feel like a lot of people still don't fully understand what mental health really means, or they're too afraid to talk about it because of the stigma, plus not everyone has access to proper help, especially in rural areas. So all of that just builds up and makes the situation worse.
Hi, my name is Ifah, come from Group 6. So my question is, why does we have a shortage of therapists in Malaysia?
Okay, thank you for your question. Such a great question. So, it has been known that mental health is stigmatized in Malaysia. So, people tend not to go towards those fields and go to other medical fields, which is more high paying than psychological field. So, moreover, psychological fields are underexposed to society, which contributes to the lack of interest towards mental health related occupations. Let's say a person want to go to a medical school. They often want to be a surgeon, orthopedic, a pediatrics, but none of them want to be a psychologist. Why is that? Because the pay is low and it is underexposed to them. They are unknown. It is unknown territory for them. So they rather go into something familiar and more mainstream rather than this niche kind of field, which is psychology, which is niche in our country but not in other country. So that is why our country has less mental health worker than America or more developed countries. So yeah, thank you.